Shopping around has never been easier these days, with the big exception of healthcare.
But now the Trump administration moving to make price comparisons easier to do, proposing new tools that help determine out-of-pocket costs for consumers.
So here to explain is Fox News contributor Deroy Murdock, also a contributing editor for National Review. Deroy.
Morning.
Welcome.
Good to see you guys.
Welcome to the picnic table.
Welcome
this
to
is
the
Fox
feast.
and Friends barbecue picnic
Thanks for
table.
having class outdoors today.
Yes.
Yes.
So what do you make of this?
I think it's a great idea. I mean, we all have the experience of going to the supermarket. And, you know, if you buy a quart of milk or you buy some eggs, you look at the price. And when it comes to medicine, we don't have that. You walk into the hospital and they don't tell you what things cost. You have the procedures done, whatever. And about 3 months later, you go home and all these bills start popping up. You know, the radiologist is this and the nurse is that. The anesthesiologist is this. Very often they're huge surprises. So what the Trump administration wants to do is to make prices available so people can shop around. If you're in an ambulance heading to the emergency room, you don't worry about it. But if you're getting your elbow fixed or you're getting something else done, you have time to look around, you can compare and say, okay, x-rays are $500 here, they're $100 there, I think I'll go over there.
This is such a common sense thing.
Completely.
But it hasn't been done, which means there's got to be a hidden reason why.
A lot of the hospitals and insurance groups negotiate the prices secretly, and they want all that covered up. And I think we need to expose all this.
So it's not a monopoly.
A cartel.
A cartel.
Yeah, duopoly, that sort of thing. And if I believe in free markets. You can't have a free market without prices. You have to have prices. If you don't have prices, nobody knows what's going on. And this is the only sector of the economy where people have no idea what anything costs, which is ridiculous.
You're going to have libertarians coming out and saying, oh, this is a mandate coming down from the government. We don't like that. But the way I see it is this is just arming people with information.
That's right.
I mean, this is the only way. It's the same way that if you go to a restaurant and they list the nutritional facts of something, they're not telling you what to eat. They're saying, this is the information, do as you wish. So how do you think this is going to pan out?
Well, the next step is the Department of Health and Human Services is looking for comments from the public until June 3rd.
Right.
Independent Women's Voice has an excellent website, iwv.org, and you can put comments and tell HHS what you think. And I think the comments so far have been positive, so I think this is probably going to go through.
Well, and Deroy, we have two of those comments from HHS's website. Let me read them to you here. Mark from Georgia says, when I had a routine physical, I couldn't find out, even when I asked what the cost of the blood work was going to be. That's ridiculous. And in this one more, Rebecca from Maine says, once I needed an x-ray and was told to use the hospital x-ray department, I pushed until I got the rate. It was about $500. The same x-ray cost me about $115 at a local urgent care center. Maine's Rebecca Pringle-Gleski explained.
Exactly right, yeah. Imagine if you flew from New York to San Diego, they didn't tell you the price, then 3 months later, United Airlines sends you the bill. It's a $5,000 flight.
Yes.
Nobody wouldn't stand for that.
And then you hope your airline insurance covers it.
You hope so, right?
Sometimes they don't.
And sometimes they don't. Sometimes they don't. You go,
exactly.
you pay your copay, and then 3 months later, you're feeling fine. You're sitting there. It's like, oh, here's $500. And you're like, wait, hold on a second.
Yeah, I thought I
didn't
paid
know
for
that.
that already.
Right,
I've had
or
that
some
experience
people
myself.
may have made a different decision if they had known that could be the potential cost to them.
It's a game changer if it was actually
I think it's
ever
huge
done.
because people will be able to make these comparisons, and then internally, hospitals and doctors will have to figure out, okay, what does this cost? What's an appropriate profit? And they'll have to do a lot of thinking, and I think it will rationalize the entire irrational healthcare industry.
So clearly we'll see this added to Bernie Sanders' rollout, Medicare for all. I covered that event on Capitol Hill, and I didn't hear anything about this.
This will be price transparency for all, I'm sure.
For all. That's kind of what it should be.
That's what it should be. Yes.
All right, Deroy, thanks for joining us at the picnic table. We'll send you home with some
all
barbecue.
service people out here
Yes,
for their service.
absolutely.
Take your pick of anything off the table when you
I think I will. Thank you.